Hello and welcome in this video. This video is the second part of the previous, in continuity with the previous video which was about jaundice, definition and types of jaundice. And now in this case, in this video we will learn about types of jaundice and diagnosis of jaundice in some detail. Types of jaundice. Jaundice is divided into prehepatic, hepatic and post-hepatic jaundice. Prehepatic jaundice is also known as hemolytic jaundice, which is due to hemolysis due to any cause. Excess hemolysis due to any cause, it may be intracorpuscular or extracorpuscular. May be congenital defect, some congenital defect. For example, it is seen in Gilbert syndrome. It is also seen in thalassemia and in sickle cell anemia. These are the examples of this type of jaundice, hepatic jaundice. Now, hepatic jaundice. Hepatic jaundice is due to defect in the liver cell, in hepatocytes. There is defect. This defect may be at three sites. Number one, failure of uptake of bilirubin by the hepatocytes. Number two, failure to transmit this conjugated bilirubin into the bile. And number third is fail to initiate biliary flow due to obstruction of the liver. Obstruction of biliary canaliculi due to enlargement of hepatocytes. Then in this case, unconjugated and conjugated bilirubin are raised. Both are raised. Number third is post-hepatic. This is also known as obstructive jaundice or cholestatic jaundice. In this case, there is obstruction in the outflow of the bile. The common is it may be in the liver, primary biliary cirrhosis congenital type, or it may be outside, alcohol intake due to any cause, other drugs, etc. may cause obstruction, and the main is obstruction in the biliary flow, right hepatic duct, left hepatic duct. Then this common hepatic duct, cystic duct, gallbladder, common bile duct, or at all these sites there may be some sort of obstruction. This may be due to trauma, this may be due to carcinoma and stone in the biliary tree. All these things will lead to this type of jaundice, obstructive jaundice. Now we will discuss about the diagnosis of jaundice. This diagnosis of jaundice is by maybe that is divided into symptoms and signs. Symptom means patient will say loss of appetite, loss of weight, anorexia, weakness, lethargy. These things are common, that is not specific for this jaundice, but he will say that his skin is becoming pale and eyeball is also yellowish in color, and the skin is yellowish in color, and he is passing high colored urine, or color of urine is changed. These things he will say. Then signs that the doctor will see that there is yellowish discoloration of skin, oral mucosa, and in the eye. Then he will see the palpate liver to see whether it is enlarged or not. These things are done. Then investigations. Investigation is very important to diagnose the jaundice. First thing is urine is examined for urobilinogen, excess or absent or normal amount. Then a stool is examined for presence of stercobilin. Its color will also say about disease. Then, for example, clay-colored stool is seen in post-hepatic jaundice due to obstruction. And then liver function test. In liver function test, we have to examine the bilirubin concentration. and whether it is conjugated is raised or unconjugated is raised. And accordingly, we can know the exact nature of the disease. Then enzymes, SGOT, SGPT, etc. are examined or estimated to know whether it is, what is the amount, what is the quantity, and in these cases this will increase. And then ultrasonography. Ultrasonography is very important to see whether liver is enlarged or not, and any type of growth, cyst, abscess is present in the liver or outside the liver, causing pressure in porta hepatic and other biliary, other parts of biliary tract. Then a stone, presence or absence of a stone is very important, and any type of growth in the biliary duct or pancreas, that will be diagnosed. All these things are become clear by ultrasonography. Then if there is some confusion, then endoscopy is done. And in endoscopy, we see, that is visual inspection of the liver, biliary tree and pancreas, pancreatic duct is possible. By that we can see that any growth, even a small growth, this is, as this is under direct vision, it is very clear. And when there is growth or any suspicion, then a small amount, that is biopsy, is performed, and this will pinpoint the diagnosis. So this is about this part of video, and in next video we will learn about diet in case of jaundice. Very much important topic, and in next video we will learn about this. So till then, thank you. Be safe, remain safe. Thank you very much.